Hello, my name is Macy Hudson, and today I'll be talking about sex ed in Mississippi. How many of you remember having sex ed in high school? Because I graduated from high school 2 years ago, I can still remember what we learned in those classes. Mississippi allows schools to choose between two types of sex ed, abstinence only and abstinence plus. I will be explaining the difference between abstinence only, abstinence plus, and comprehensive sex ed, and how using comprehensive sex ed in Mississippi can decrease our teen birth rate and lower Mississippi's chlamydia and gonorrhea rates. There are a few different types of sex ed available to teens in this nation. Mississippi allows schools to teach abstinence only and abstinence plus. In abstinence only education, sexually transmitted diseases, or STDs, and contraception is censored. It teaches that abstinence should be the only form of contraception used to prevent STDs and pregnancy. Religious groups often encourage this type of sexual education. Abstinence Plus does educate on STDs and contraception use, but strongly encourages abstinence to be used as contraception. Comprehensive sex ed educates on STDs and contraception, and it does teach on abstinence as well, but it allows teens to come to their own moral decisions and what they want to do. How are we going to decrease the birth rate in Mississippi? Did you know that according to MississippiFirst.com, 38% of teenage girls that have children before the age of 18 get a diploma from high school by the age of 22? This could be easily fixed with a more in-depth sex ed. Teaching more about contraception can greatly decrease the birth rate in Mississippi. There are a few different types of birth control, the most effective being oral birth control, and that is 99% effective. The second most effective is condoms, and they are 98% effective. These two are easily available and very cheap. Sometimes you can get them for free. Female condoms are 82% effective, and spermicide is 72% effective. There is now an emergency contraception, and this is very new. This is a picture of Plan B one-step. It's also called the day after pill. Plan B is effective for 3 days after unprotected sex. It is 95% effective 24 hours after having unprotected sex and decreases up into 72 hours. A lot of people think that this is the abortion pill, but it is not, because if the egg has already been fertilized, then the pill is completely ineffective. We can look to Massachusetts to see how comprehensive sex ed would benefit Mississippi. Massachusetts is the state in the nation with the lowest teen pregnancy rate, and they do have comprehensive education. So they are learning about the different types of birth control and the ways to prevent pregnancy and STDs. Now, pregnancy isn't the only problem that Mississippi has. We also have the second highest chlamydia and gonorrhea rates. Comprehensive sex ed would teach how to prevent these diseases. It would also inform teens on how to treat gonorrhea. Today I will show you how a nurse would treat a person with gonorrhea. There is a one-time antibiotic used. It's ceftriaxone, and the nurse would draw up 250 milligrams of ceftriaxone and would then use this 1-inch 21-gauge needle and inject it into the buttocks, and then would administer 1 dose of azithromycin orally. That is the treatment for gonorrhea. Chlamydia is treated very similarly with a one-time antibiotic. They're not learning this in Mississippi because our sex ed is very limited. Today we have looked at a few different types of sex ed along with the benefits of each one. We looked at how behind Mississippi is in comparison to those states that have comprehensive sex ed as well. Instead of letting dogmatic beliefs overcome us, we should encourage our state to choose a curriculum that benefits our youth and their future. Thank you.